Hi, this is going to be the presentation for the preliminary report Group 4 on malaria prevention based on education in Kofikwe, Ghana.
Okay, so to begin with, we're going to introduce this village a little bit, just the area and demographics. The Kofikwe village is located near Kawuku, a town in the eastern part of Ghana. It is a rural village with a smaller population. So compared to most villages, this is one of the smaller villages. The education level, is very low, as well as the average income. So a typical day in this village would consist as the community waking up early just because due to the hot temperatures. So they would need to get their day started pretty early. And then the schools for the children, they are made up of 6 to 7 villages. So the schools get pretty crowded there. And like I said, the education level is very low, which would which would complete into a low average income. Most families work in the local crops in order to provide food for themselves. And then this village life is usually a slow-paced life. It's not the fast pace like we're used to in the States. They kind of just go at their own pace, and they take advantage of what they have, and they show their gratitude for that. And then road conditions are dangerous, so not much traveling is done outside of the village. They stay where they have been raised, and no one usually leaves. Excuse me. An example of this would be if an individual is sick, then the local villagers will carry the sick individual on their shoulders to the nearest transportation site so they can get to the nearest hospital. So it is kind of a hard situation for them to travel out to get help with their health. And then last is it is one of the highest poverty areas in Ghana. So they do struggle, and they are very poor in this area.
So malaria is a disease that exists in Africa. And so we'll give a little bit of information about that. According to the CDC, malaria is normally caused when a person is bitten by an Anopheles mosquito that has been infected by one of the malaria parasites, and there's several of them. It is carried in the blood, and therefore you can get it through infected blood from a blood transfusion, or through a mother might be able to give it to her child before or after delivery. It's common in warmer parts of the world, and that's because those are areas where mosquitoes can really thrive and the malaria parasites can fully develop. And so Africa would be one of those places. Symptoms range anywhere from asymptomatic to flu-like, which includes fever, chills, and nausea and achiness. The diagnosis is through taking a blood sample and looking at it under a microscope to see if there are any malaria parasites among the red blood cells. If you get this diagnosed promptly and treated quickly and correctly, then you'll probably be good to go and you'll recover well. In order to prevent malaria, some of the steps you can take, especially for travelers, are taking anti-malarial drugs, and also when you're in the location where malaria is prevalent, avoiding mosquito bites. And you do this through, among other things, using mosquito nets that have been treated with insecticide. Those most at risk of dying from malaria and of getting malaria are people who have a lowered immune system, for example, children and pregnant women. To treat malaria, we use prescription drugs. These include drugs like Molarone and Primaquine. Both of those are used just a couple of days before traveling, and you take it once a day. And then up to a week after, every day up to a week after you exited the country where the malaria is. Also, chloroquine is taken on a seminal basis, just once a week, but it does need to be started a couple weeks before traveling and continued after a couple weeks after coming back from a country where there's malaria. If left untreated or if complications arise, malaria can be fatal, and most of the malaria-related deaths in the world are from children in Africa under the age of 5.
Malaria is one of the largest burdens to the regions of Ghana. Malaria kills about 3,000 children every day, and over 1 million people die from malaria each year, mostly children under 5, with 9 out of 10 malaria cases occurring in this area of Africa. Pregnant women and their unborn children are particularly vulnerable to malaria. There are many barriers to prevention, treatment, and care. Many reasons account for this are the efficient mosquito that transmits the infection, a high prevalence of the most deadly species of parasites that are there, and the favorable climate also promotes mosquito growth and the spread of malaria. However, they have a weak infrastructure to address the disease, and high intervention costs that are difficult to bear for the poor countries. But prevention is important. The Center for Disease Control recommends these general rules: no standing water, clear areas around homes, netting over sleeping areas for children and pregnant women. The IEN, which is the insecticide-treated nets, are particularly useful in keeping the vulnerable population from being affected by mosquitoes. And a $2 net the cost of the net is $2, and it lasts for 3 to 4 years and protects on average 2 people. So nominal cost effective prevention, where cost is a factor, is the use of planted mosquito repellent plants. There are a few that are been determined to be very effective against mosquitoes, which are lantana, lemon thyme, and rosemary. But thought to be the most effective natural mosquito repellent is the citrosa plant. So the citrosa plant was developed to be with the idea of capturing citronella in a plant to keep mosquitoes away. Planting only a few feet around a home and a shelter can keep mosquitoes from coming in and out, or coming into the home environment. The most practical way to use citronella is to blend it into a mixed container gardens that you have around you in your patio in the evenings. This will be effectively create a lemon-scented perimeter. And ideally, blending it with some of the other mosquito deterring plants will reinforce your defense.
So we want to bring some malaria prevention and education to the village of Kofikwe in Ghana. One of the biggest challenges that we face in this area of the world is that the local beliefs are very much driven by superstition, and they believe in a wide variety of supernatural causes for disease. Frequently, Western medicine and even aid is suspected of being bad. One of the methods that we have seen to be effective in people who have worked with this population is addressing the village chiefs and respected members of the community first. The organization that we propose to partner with, Nurturing Nations, has set up a medical clinic that ran recently. And one of the things they said that they did was the very best was to use doctors and nurses from Ghana. The organization, the American organization Nurturing Nations, provided the financing and the anti-malarial medications, but they were all administered and all of the exams were carried out by Ghanaian doctors and nurses. So in this objective, We are very aware that we need to address this in a culturally sensitive way and go about teaching this in a way that the community members will accept. So the intervention that we are proposing is to get in touch with our contact, Laura Belk from Nurturing Nations, to get information about the tools that they need to be successful in their efforts to combat malaria. Nurturing Nations is in this area of Ghana, building a school and a home for orphans and disabled children. Kofikwe is the nearest village to this home they're building. And so they're very invested in good relations with this village and promoting the health of the children that they serve there. We, as a group, we think that the best thing we can do is to raise awareness here, to work on maybe providing funds for nets or seed packets for those mosquito repellent plants to be provided, and really to be a support to our partners who have the contacts there in Ghana. And thank you for listening to our presentation.